Welcome to the Ultimate Men's Movement. I'm Dr. Jack Rocco, your host. We have an interesting topic today. We're getting into the realm of healthcare, health insurance, concierge medicine, and how to pay for a lot of these treatments and health. And it's very confusing. And I have a guest who I've known for 30 plus years at this point, Bill, probably circa 1988 or so that we ran into one another. Bill is a classmate of mine, fellow Pittsburgher, and he has been I'll let you, he can get into his career, but he practiced medicine for years and then is transferred into the realm of healthcare coverage. So this is Bill Hennessey. He's coming out of Naples, Florida for us today. So welcome to the Ultimate Men's Movement, Bill. Thank you for coming.
Hey, glad to be here, Dr. Jack.
Yeah, and you've been on Dr. Phil. You've met with President Trump. You have become, I'm honored to have said that I knew you back when you were a simple country boy from Pittsburgh, Pennsylvania, and you've made quite a name for yourself in this arena, and for your family. Maybe just let's start off with your career in medicine. You're a physician. You're an MD. And I think that's who should be involved in some of this healthcare coverage because it's become such a big item. So go into your career, Bill, and then we'll get up to speed with your company after that.
Well, again, thank you. The goal is not for any fame here, Jack. The mission is the slogan, helping millions save billions on healthcare. We are called to serve others. We do that. It comes back tenfold. So, yes, I've been a doctor like you, and quickly I realized there's a four-word definition of an insurance company. They collect premium, deny payment. And boy, guys like you and I put in the long hours, and then we get these denials. Well, I also founded a medical billing company so that I could do my own billing. And then I realized I had a skill at it, and we did it for other physicians. So now I got into the billing coding, the claims, what the real fee for service is. And that started to, in 2014, develop into Pratt, Price Matters, a price transparency company. And from there, the goal was, let's separate healthcare from health insurance. Let's let people see what the price of care is before they get it. And then the reality of it is we don't purchase healthcare every day, every month. For some people, not even every year. So they'd end up with surprise bills because they didn't follow mine or your advice on where to get care and how to save money. And then we dealt with big bills and negotiated them. And there's ways to get free care under the Affordable Care Act. And so we evolved from a price transparency company into a care navigation company. And I've done this now for 12 years. My dad was a hospital administrator, board of director member in the Pittsburgh market for over 50 years. So I like to say, we know how hospital executives think and behave, and we use that against them in our software, in our techniques to save our clientele money.
That's great information. I mean, that's a great a merger of information. You, the son is physician, the father is hospital administrator. I guess I wasn't aware of that. I didn't know your father's connection to hospital administration. So that's a fantastic merger of information and a resource. Now, just let's break it down into bare basics. Why is medicine so complicated when it comes to pricing? You look at a TV, you can Google, you can go on Amazon, you can find out what this TV costs approximately and the supply and demand. But healthcare doesn't work in terms of supply and demand. How does it work? I'd like to give an explanation, but you perhaps have a better idea.
Follow the money. That's all I got to say. Follow the money. There's 5 entities that are the enemies to affordable care. Those 5 entities want the cost of care and insurance to go up. Their names are hospitals, Blue Shield, United, Cigna, and Aetna. They collude to increase the pricing. There are actually 3 federal mandates for price transparency. I could go into them, but I risk boring your membership. Let's just say there's federal laws on the books. Why don't the hospitals follow them? It's pretty simple. They have the biggest lobbying money out there, and they pay people off so that these laws effectively become window dressing. There are no fines, and there is no jail time for hospital CEOs and CFOs that don't provide all of the information they're supposed to for price transparency. So they make more money by hiding the price.
Yeah, and there's no enforcement of these laws. I love the term window dressing. I mean that it sounds good. It makes a nice photo op for the congressman and the president or whoever. But when it comes down to money on the street, like affordable health care, the Affordable Health Care Act, and if you look at the price of health care since the Affordable Care Act, it's done nothing but go straight up. How can they call it affordable when it's become less affordable and we all feel that pain?
It's just in the name. For example, since the Affordable Care Act, which I've nicknamed the Unaffordable Care Act of 2010 passed, if you were making $50,000 a year and your salary went up as much as Cigna's stock the past 16 years, you'd be making $500,000 a year. Now
Really?
let's get real. I don't know anybody doing that was making $50,000 a year in 2010. So the Affordable Care Act directly paid monies to Blue Shield, United, Cigna, and Aetna for health insurance premiums. Insurance premiums, I said, but that did not buy one person in the United States $1 of care, because now they have $10,000 deductibles and they're still paying for all their care out of pocket because nobody meets a deductible that high. So again, hospitals, Blue Shield, United, Cigna, and Aetna collude to go ahead and increase the price. The more you can avoid those bad hombres, there's lots of ways to get excellent care at an excellent price.
Yeah. Now, so that's interesting because one, that's an incredible stat. If you would have bought, stock in the insurance company versus your salary, that's huge. I've not heard that before. One of the quotes that I always use, because us evil doctors, quote unquote, evil Dr. Evil here, we're the ones taking all the money out of the system. It's like you rich doctors, and we both grew up in pretty humble beginnings. And this idea of me being a rich doctor just has never made it into my brain. It's never made it into my checkbook, to the extent that insurance companies do. But when we met early 1980s, let's say the average physician, just for numbers' sake, made $100,000. Just for a round number. So I'd give you a number. Dollar for dollar, not even counting cost of living, but dollar for dollar, the average physician now makes $70,000. No cost adjustment, no cost of living. $100,000 in 1990 is now $70,000 in 2026. Is that about your estimate for where physicians' salaries have gone over the last 30 plus years?
The most accurate statistic is 25% decrease in pay from 2010 to 2026. So, in other words, physicians are the only job, being a doc's the only job where as you get more experience, your pay goes down.
Yeah.
And what is happening is hospital lobbying money in DC is making sure that they get their 2 or 3% increase in pay every single year. But they're trying to make sure that we don't ever get a raise or we get demoted 2 or 3% every year, to force ultimately physicians to go out of business or be bought by hospitals who then use the electronic medical record to control where doctors refer patients to their most expensive facilities to generate revenue. It's no secret. A neurosurgeon's worth $3 million a year to a hospital. A family doctor's worth $800,000 to $1 million. So if he was making 150 K now, and you give him 2.25 for 2 years to make his buyout feel good, so he's not shamed by his colleagues, that's what's going on. And then what they do is after the 2 years, they say, well, you're going back down to 150,000. Why? Well, because we can, and you were dumb enough to sign a no compete clause, and your family likes it here. So get in line and just refer to places that are in our electronic medical record to make us rich while we crush your salary and own your tail end. It's
Yes.
not. It's a real touching story. I'm just not going to say where.
Yeah. Um, the other issue that I want to be fair and balanced here. I want to be totally fair and balanced. And we grew up in a day. I always say, I've got this incredible instrument that just came out, this high-tech instrument that's right here on the end of my hand. That as an orthopedic surgeon, I can examine a knee, I can examine a shoulder, I can press here and I get a response from the patient. I can take your arm and I can move it this way. A physical examination, a physical examination, which is what we were taught back in the day, was something we focused a lot on. But not only do I have this high-tech instrument here, it's connected to updated and mature software.
Right.
My experience, my knowledge. I look at the patient, I see a patient that's a 22-year-old athlete, buff, probably on steroids, possibly on steroids, healthy, versus a 96-year-old woman who comes in with a walker and a degenerative knee. All this data that we're getting on a day-to-day basis that goes into our history and physical used to be the hallmark of healthcare. You see a doctor, he's going to examine you and then hone the treatment. Okay, you need an X-ray, you might need a CAT scan, you might need an MRI. These things have gone over the years. But now it's gotten to the point where before you even walk into the office, a lot of times you got, this test, that test, the other test, overutilization and patients' expectations for overutilization. You just examine a patient, they're like, don't I need an MRI? I'm like, I just gave you an exam. That exam is worth more information to me as a physician to know what to do than an MRI that has just more information than you need. It depends on what person it's connected to. So
Yeah.
what role does overutilization by physicians, overutilization expectation by patients, overutilization expectations from the hospital, because if you order more studies, you get paid more, and overutilization by the insurance company that, they have a guaranteed return. So that if suddenly their claims go up tremendously, their percentage of their claims are guaranteed as a profit. So that the system is really designed to spend a lot of money on your behalf to thrive. And no one is putting the brakes on that. No one is saying, well, we try, but we still order a lot more tests than we used to. How does overutilization play into this
Well,
hyper expense of healthcare?
the important thing you said in the is there's a doctor-patient relationship. That's the most valuable thing. Because no matter what a patient says to you or what test a patient has, ultimately they presented with a complaint, they have a diagnosis, and they need treatment. They need the touch of a human being known as a doctor. And doctors only are 8 cents on the dollar for healthcare. Healthcare, clinical care is spent in only four buckets: outpatient care, such as testing and outpatient procedures; inpatient care, meaning you're hospitalized; drugs, that's the biggest of the four buckets. And the last is doctor visits. We're under 10% of the whole healthcare dollar. But that's the real value where rubber hits the road and you get treated. Uh, yes, in the emergency room, especially, there's a lot of defensive medicine. It's not my money, says the doctor or the hospital, but we're going to order more tests and make more money. There's abuse there for sure. And when my firm negotiates hospital bills, we call out that abuse. That's an unnecessary test. We're not going to pay for it. The head bone's not connected to the toe bone. Why'd you do that head CT? He dropped a hammer on his foot. I mean, there are very wasteful tests out there. What I also tend to see, and I'll probably offend some colleagues, but I only care about patients, Jack. And that is, it's only about the patient and who cares the most. Generally speaking, it's private practice doctors. There's studies, as well as common sense, that says as soon as a physician's employed by a hospital, he or she has a drop in productivity by 50%. Whether you live or die, it doesn't matter. You're getting the same paycheck. Whether you see 15 or 20 patients a day, you're getting the same paycheck. The goal is to skate and see the least number of patients. So if you want to align incentives with care and outcome, every single one of about 900,000 physicians in America, we should all be in private practice and we'd all be only doing what's best for our patients. And there wouldn't be any hospital administrators or insurance executives telling us what we can and cannot do because you know what? We're the experts at healthcare, not them.
Yeah. No, and I mean, we've been in it and we see it. And you're right. And I've been on both sides of the fence. I've been private practice, I've been solo physician, I've been a military physician. I've been in a practice that's hospital owned. I've been in a multi-specialty group with many different doctors. And far and away, my best work, my most efficient work, my most fulfilling work was in private practice, where you could control your costs, you could control the patient demand, and ultimately the patient was coming to you. Now you go see a provider. That provider may be a physician's assistant, it may be a nurse practitioner, it may be an MD, it may be a subspecialist MD. But the salary, the cost per person ends up being the same. Like the insurance company pays a PA under supervision of a physician who may or may not see the patient. The physician could be down the hall in his own room, seeing his own patient, never look at the chart, never look at the patient, and they're able to bill the same fee that a physician would get. But you, as the patient, you're getting a 26-year-old nurse practitioner, a 30-year-old physician's assistant. Are you getting the same quality of care with those equal providers?
I say no. And I have a daughter that's a physician assistant. So they do have a role in care. But when it comes to diagnosing and setting up the treatment plan, that's got to be the doctor. Now, can the physician assistant help carry out the treatment plan? Sure. But the way the hospitals use them, you have one doctor and he has three physician assistants. He could be seeing a patient, they're seeing one. And even if they properly use the physician assistant's national provider identification number to say, we admit it wasn't the doctor who spent the time, there's still billables for four different patients at the one time, even though there's only one doctor. And, that's it's misalignment. And if you ask any patient typically, who do you want to diagnose you or see you? It's the doctor. Why is there a 25% physician shortage in this country? I'll tell you. The electronic medical record slows even an IT savvy doctor down by 25%. And then the government now says there's a shortage. No, there isn't. There's bogus robo documentation going on to use physicians like pawns for generating revenue. Get rid of that, and everybody can go back to seeing a doctor for the diagnosis.
Yeah. No, like I said, I agree. And the other thing that, I tell patients this all the time, and it's absolutely true. I am a much better doctor in 2026 than I was in 1992 when I got out of medical school. And it's not because some of it is because of education, book work, but a lot of it is because I'm getting all these things that I've been treating for years. When I was a young 32-year-old orthopedist and in the military or early in practice, I'd see a 56-year-old patient, 60-year-old patient, with a tendonitis. And I'm like, buddy, your x-rays are normal. Your motion is good. You just got a little bit of a tendonitis. I don't know why you're complaining so much. It's not a fracture. It's not a tumor. It's not a blood clot. It's just tendonitis. But now that I'm my own nearly 60-year-old person, I'm like, no, you don't get it. Tendonitis is hell. Bursitis is hell. So, as you age and as you begin to experience these things,
Nothing
it's really
replaces
important.
real life experience.
Yeah.
And toward the end of my clinical career, the fun statement I had, and then I was given a coffee mug that says this because they existed and I didn't know it, was don't confuse your Google search with my medical degree. Now we could say, don't confuse your Chat GPT search with my medical degree. Real life experiences and nuances of each person's situation and being hands on, it does matter. Now, those sources are great for supporting education, but when it comes to the actual diagnosis of what treatment's best and why, again, I'll repeat, for less than 10 cents on the healthcare dollar, you can't beat interaction with a physician.
Yeah. And like I said, and life experience, like this, I'm petrified with what's coming out with AI, and, I hear Elon Musk say that, in X number of years, this Optimus Prime, this robot, is going to be more skilled, more efficient, more practical, as a surgeon than all the surgeons in the world, you know, and, I've always been taught, and it's filled out over the years, the best surgeon knows how to operate. You know, a better surgeon knows when to operate, and the best surgeons know when not to operate. And that comes from experience. And I use the word spidey sense a lot, which is not a transferable definition, but my spidey sense has, got me out of a lot of trouble and saved a lot of patients over the years. And I interpret spidey sense as it's 1,000 bits of information. It's 1,000,000 bits of information from your past, from your from the patient, from past experiences, from textbooks, from surgeons, from this one that went bad, you know, and all this uncountable amount of data goes into your body, comes out in emotion and senses that says surgery now. Like we've got to do this yesterday. Or settle down, Mrs. Johnson. This is not an emergency. We can give this a week and see if it goes away. And those are two different things that I may be getting the same input on both. Like I said, is it a 90-year-old woman? Is it a 45-year-old man? Is it a 17-year-old kid? When you assume all those things together, it comes out in a spidey sense. I don't know how AI is going to compete with that spidey sense of experience and knowledge and human need, human desire, human purpose.
It won't. I use the term it will augment physicians' clinical education, but you're still gonna need the doctor. A famous professor, God rest his soul, passed at 92. Dr. Ernie Johnson. He called her an Aunt Minnie. So common things happen commonly, but when you saw something a little uncommon, but he knew what to do, he called that an Aunt Minnie. I said, "What do you mean?" He goes, "Well, she's difficult to describe, but you know her when you see her." So,
Yeah.
so but what we're getting at here is we've talked that the price of care and insurance is too much. The best value is when you get the care and it's at the doctor level, but there's decreased access to doctors because the hospitals and government want it that way to control us. But what we're seeing is there's more concierge medicine, there's more DPC, direct primary care, there's more fee for service. I pay cash for my primary care visit and some outpatient testing. So everything eventually has a circular lifestyle. I think right now has been the tipping point the past year where the cost of care is too much and unknown. The cost of insurance is too high. We have a record number of, I believe, 50 million, possibly as high as 70 million that do not have insurance anymore this year. So now what we're seeing is people are absolutely demanding, I need to know the price and I want to see a doctor. So I think those models that put the patient first they're going to succeed. And you're going to see new insurance offerings that have nothing to do with Blue Shield, United, Cigna, and Aetna because they're so corrupt. And we're going to see success evolve. We're leaving the world of Blockbuster and we're going into the world of Netflix and healthcare.
Yeah. No, so how does your company, let's get it, so I think we've identified a lot of problems with healthcare, a lot of problems with the evolution, the control, this and that. But I love that you've got onto the cutting edge of the sword. You are the point at the tip of the spear, so to speak, in delivering good care at a good price that's transparent, that's predictable. Explain your company and your mission and how you've evolved your experience into the billing side of things where the rubber hits the road.
Yeah, so I'm going to give some high level strategic thinking that every listener can understand. First of all, if you separate health care from health insurance, both cost less. Number two, don't go to the hospital unless you need hospitalized. It's the most expensive place for routine care like blood work, imaging, or elective procedures such as a GI scope or a carpal tunnel release. If you do get hospitalized, you need our hospital bill eliminator program. We look for free care first under the ACA or discounted care. Combined, that's 100 million people that don't realize that that's available to them. Or we negotiate the bills and average about 70% off bill charges. And lastly, there's only two times to save money on care, either before care occurs or after care occurred. The best is prevent a problem before it happens. And that's where I created and co-created Health Freedom, healthfreedomus.com. And I know for a fact, people don't want to be PhDs in medical billing or understanding care costs. So we have 3 health bundles where you can get out-of-pocket care with no out-of-pocket care, excuse me, at the time of service, but you're paying, let's say, a flat $50 a month or $70 a month. You're getting unlimited no out-of-pocket telemedicine and telecounseling. So you do have access to a doctor that way. You got up to 6 in-person urgent care visits. So 40% of America doesn't have a primary care physician. That's not a good thing, but that's the 20 to 40-year-old population. Or you're traveling and you just need to see a doctor. You could go to the urgent care. We'll pay for your visit ahead of time. You have access to over 1,000 drugs being mailed to you at your doorstep, no out of pocket. You have our price transparency and bill negotiation services. We can tell you where to go and what to pay. Get all the care done in your family doctor office. But when you go to another building for the blood work or imaging, it's going to cost a lot more unless you let us guide you. We also have an affiliation for blood work with Quest Diagnostics where you can get no out-of-pocket blood work, urine cultures, strep throat cultures year-round at over 2,600 locations. So I pretty much just described everything that you could get that your family doctor might prescribe. And let's say it's $50 a month. Now, what happens when you go get that care? You don't have to think. There is no price to pay. There's no extra bill. There's no surprise bill. And so we simplify and you say, well, that's a lot of care for that little amount of money. How can you do it? It sounds too good to be true. The answer is Blue Shield, United, Cigna, and Aetna, and hospitals are not involved. There's lots of good business partners in the healthcare savings arena that will get you great care at a great price. But you have to leave those 5 entities I just mentioned in the rearview mirror.
So does that mean that you don't have the choice of physician? You have to go with someone who's still paneled by you? Or
No, we want you to, that's a great question. No, we want you to get care at your family doctor of choice, no matter who that family doctor is. A family doctor visit is not insurance. Insurance is for a financial catastrophe. US of A, as paid by the likes of Blue Shield, United, Cigna, and Aetna, a new outpatient office visit is $175. An outpatient follow-up visit is average paid at $125. That's not insurance. We think you should see whoever you want as a family doctor. But if that family doctor, and you should just pay cash. I just gave you what the typical prices are. And then when that doctor prescribes care, blood work, a chest x-ray, a screening mammogram, or screening GI scope, well, that's where we'll take over and we will help get affordable access to care. Because if we are sensitive about it, it's either affordable care or 2 out of 3 people just don't get the care. They're afraid of a surprise bill and predatory billing.
Absolutely. That's a big impetus, for misdiagnosis, missed cancer. If you're afraid to we've all had those patients, you order a test and they don't go for the test. Well, what happened? Well, I didn't, patients are sometimes difficult too.
Yeah.
But,
If it's an x-ray, Jack, I experienced they get it. Okay, that doesn't cost much. If I ordered an MRI, I'm worried they're not going to show up for follow-up. And, that's what would happen. Again, follow the money. They didn't have it.
you can prescribe it, but you don't necessarily know when you're prescribing what plan they're on, what their copay, what their deductible, how much of it they've met. So if they've got you order an MRI or a CAT scan, they don't have $1,000 in their pocket to pay for this. So they'll go away.
Well, the average deductible now is $8,000 US of A, and 90% of America does not meet its deductible. So they're paying blindly for care, too much for care, and still not meeting their deductible because it's too high.
And the deductible's not even counting their monthly premium. So if you've got an $8,000 deductible and you've got a $2,000 a month insurance bill, that's not unusual.
Oh.
You know,
And what's the definition of an?
That's $20,000 in healthcare a year that you are
Correct.
spending before you get one dime out of your insurance. So
100% sad and wrong.
$20,000 is coming out of pocket for a lot of people before they even get a Tylenol.
Right. Well, again, healthcare is not insurance. So the goal was for a very affordable price, get a whole bunch of care for one fixed low amount, and just get all the care you need when you need it and when your doctor says you need it. That's what I have created. It works at healthfreedomus.com. And then there's going to be another step. In about a month, we're going to come out with a health plan with a $1 million catastrophic coverage with a $0 deductible. And it's going to be probably about a third the price of current health plans by publicly traded carriers. So we're going to go back to the days before the ACA and offer that $1 million catastrophic, and it's going to be plenty good for 99.99% of people at about a third, maybe 40% max the price. Again, I said no deductible if you get admitted.
That's what people want. Like I said, when you're going to spend $20,000 a year for healthcare, a lot of people are like, yeah, but you know what? If I get one hospitalization and it's $100,000, I just saved 80, But how often do you get those $100,000 years? Very infrequently,
I round off the actuary stats. I say commonly 1 in 100. It's an easy number to remember. Probably technically it's closer to 1 in 120 people of commercial working age. That's age 27, post Affordable Care Act. You can't be on mom and dad when you're 27. In pre-Medicare, age 64 or less. If you're between 27 to 64 years of age, again, mostly in your 50s or early 60s, you got that's 1 in 120 gets hospitalized. Yeah. That's not that many. So again, better than 99% of people just need access to care. They don't need that expensive insurance. The Affordable Care Act says you can be sick or die for 5 or 10 million. There's no limit. the reality of it is $1 million in coverage is enough for just about everything for everybody, and a bill should never exceed that anyway. And if it does, it's just fake fluff.
Yeah, no, great. I went through this with my mother in 22. She had a heart attack and stroke in February,
Mm.
and then she had a small bowel obstruction in November. And her hospitalization in November lasted about 10 weeks, and it was over $1 million. And I went up there and thank around Christmas time, and I said, Ma, she was miserable. She was out of her mind miserable being in the hospital for that long. And it was horrible to see. But she comes in, she's like, Jack, I'm just so itchy. I got rashes, I got this and that. I said, have they put you in the shower? She's like, no. They've been giving her bird baths for 6 or 8 weeks. And I'm like, Ma, I'll put you in the shower. I literally got my 84-year-old mother
Oh,
onto a,
geez.
onto a shower chair. I rolled her in there. My kids are, they're, Daddy, you're going to get in trouble from the nurses and, what have you. And I'm like, I'm okay. I'm okay with this. She changed my diaper, and, we're in there and we're laughing, it was a moment. It was a family moment. I'm like, all right, Mom, I'm going in for the butt. She's like, go for it, Jack, and I gave her a nice shower. I pulled her out of that shower. She looked like an athlete, like an athlete sitting on a bench. She had a towel over her head. She's washing her hair. She's like, I feel wonderful, and that was one of the major things, that allowed her care. And I guess my point for all this is $1 million worth of health care, high tech, but not one single shower in 10 weeks, that
Well,
I had to give personally. And I was glad to do it. I'd do it 100 times. But preventive care, simple, basic nursing care, good food. I think if you go into rest, you can't sleep in a hospital. Good food, forget about that. She was getting this SOS, stuff on a shingle, um, either turkey or roast beef, so no sleep, horrible food, no exercise. She's sitting in bed, no cleanliness, you take those 5 or 6 basic things, that's a big portion of health. And like you said, it's not health care, health insurance, it's health. And that's what, we promote at the Ultimate Men's Clinic, is health, exercise, diet, avoid the bad foods, sleep, have relationships. What role do all those play, in health that cost you minimal to nothing?
well, they're priceless, really. I say, name the best pill that at the best price that will have no side effects and lowers your blood pressure and lowers your cholesterol and lowers your stress. It's called exercise. Exercise is that best pill. Aside from that, you're right. Proper nutrition is, that's good medicine too. That counts as medicine. If you eat right, you're healthier. And to your point, this is RFK was just on TV this week mentioning hospitals need to have better food. You go there to supposedly get healthy, but you're eating your stuff on a shingle, as you said. Wait a second. You look at that food, you say, you're sick, but trying to get better, but you're eating that? It doesn't make any sense.
Yeah, and the healthcare of, whether you be, I try not to be political, and I think I'm honestly am on the fence with most things. I mean, there are things that, but RFK, how can you argue with that? Eat real food. You know, you go to many physicians, they smoke, they're overweight, they don't exercise, they don't sleep, they're staring at screens. Your role model as physicians is not always the best thing. And
No.
would you go to a financial planner who's broke to manage your money? Yet we go to physicians who are in horrible health. And I'm not trying to tick people off, but we've all seen it. Doc, how is your advice working out for you? How
Well,
easy is and I said, for me, the Ultimate
there,
Men's Clinic, this is the stuff that I need,
well,
and
there needs to be I'm going to go to the guy or gal who practices what he or she preaches.
mhm.
So again, generally speaking, a form of concierge medicine or direct primary care, your ultimate men's clinic, you are practicing what you preach. You're an expert in it, you're practicing it, and that's being passed off to those that you serve as patients or clients. That's actually the way it should be. There's a financial alignment and a clinical alignment for a good outcome. If we go to a hospital CFO and say, well, did mom get her shower today or her gown changed? Let me tell you how often I heard that in the past 30 years. Okay, I'm done. Not once.
Yeah.
So, who's the expert in healthcare? The doctor. Let's put the doctor in charge. Let's get rid of the insurance companies. Let's get rid of the hospitals. And when you set up a clinic like that, that is going to be successful in any era. And I believe with a complete certainty, it's going to be more prevalent this year and next year and the year after.
Yeah. And I said, Bill, I mean, like I said, we've known each other for 30 plus years. And, you were all, I mean, both of us, we were in good shape. And it's good to see that we've maintained that, and, I think also we both have active minds.
But
Um,
what happened to our hair?
well, you saw me with hair before, Bill.
Yeah.
I never loved my hair to begin with. I had this pseudo afro, bozo the clown kind of hair. Hair was never my strong point. So you're right, but I attribute that to testosterone. They say there's only so many good looking heads and the rest are covered with hair, but lack of hair is actually a sign of virility. So I'm sticking to that one.
Okay. Well, clinically, I say you don't have a forehead, you have a five head.
Yeah, exactly. But
Big forehead, yeah.
no, Bill, we're getting to our time here. We've had a lot of conversations, a lot of in depth. What is your bottom line? Take 5 or 10 minutes. Your
Yeah,
bottom.
let's give people some good information that they could use, even if they don't sign up for Health Freedom, because I care about people. Hey, everybody out there, on average, if you go with a private practice family physician, that over the course of your life is going to cost you one-third of what it would if you went with a hospital employed physician. So if you want to save money and get great care, look for a private practice family physician. Number two, only go to the hospital if you need hospitalized. Otherwise, look for non-hospital owned blood work centers like Quest Diagnostics or LabCorp or Clinical Pathology Laboratories, or look for an independent imaging center or a surgery center that's owned by physicians instead of hospital executives. And if you did go to the hospital, know that none of them in the United States provide you with an itemized bill where you could see the names of the care items unless you ask. That's crookery. It is illegal according to me. It hasn't been tested in courts. It's poor customer service. Under privacy law known as HIPAA, Health Insurance Portability Accountability Act of 1996, your itemized bill is your piece of personal property. You own it. The hospital must give it to you and at no cost. And you're not going to pay even $1 towards your care until you get to see the name of every care item and what they charged. Get that first. That's going to delay what you have to pay by 1, if not 2 months. That's how poor they are at getting it back to you. But keep your money. And if I had to pick one number, if you got a big bill in the ER or a big bill because you were hospitalized and your claim is denied or you don't have insurance, how much on average do they really pay? Meaning the insurance companies to the hospitals fee for service, 30 cents on the dollar that you're billed.
Oh, absolutely.
Okay, so never pay that full amount. Maybe offer 25, 30 cents on the dollar and payments over a year or two on a bigger bill. I'm giving you that as free advice. Also, ballpark, most of you making 30 to 75 grand qualify for free care or steeply discounted care. Even without insurance, you say, wait a second, what is going on there? The answer is this. Under the Affordable Care Act, there's an IRS provision. It's called 501R. Let's say you forgot about it. Let's just say there's a federal law that says because nonprofit hospitals, That's by their tax status. Don't get me wrong, make lots of money. They have to give free care back because they benefit $40 billion by their tax strategy. I say they should give a good 20 billion of that back as free care to their communities, and the IRS calls that community needs. So if you're a family of three, making, about 55,000 or less, or a family of four making 66,000 or less, you get free care at over 5,000 hospitals. There's many larger cities where that benefits richer. You could be a family of three or four making 100 grand and still get free care. The financial assistance application for these big bills exists at the financial counselor office of each hospital. So you could Google financial assistance and fill in your hospital name and look at it. Or you could call the hospital and ask for the financial counselor. So one, always get an itemized bill on a big bill. Two, never offer to pay more than 30 cents on the dollar. And three, go ahead and see if you qualify for financial assistance, especially if you're 30 to 80,000. Maybe if you're a big city like Miami, Boston, New York, or LA, or Houston, go ahead and try to get a financial assistance application. They can't do anything with a bill under those circumstances. And lastly, maybe you heard me, maybe you like it all. I hope it helps some of you get free care that you deserve. You can always sign up at healthfreedomus.com, and you got a team of price defenders there and partners ready to serve you with no out-of-pocket care for blood work and urgent care and drugs, and it's all there. But if we back it up a step more, the last thing I'll say in closing is this: what costs the least and feels the best is stay healthy. Exercise some in moderation, eat well, sleep well, don't smoke, drinking mild, moderate at most, and you're not going to need any medicines. You're not going to spend much on healthcare, and you're going to live longer and be healthier physically and financially.
You're here. Absolutely. Thank you so much, Bill. Really appreciate it. We'll have your information in our show notes if anyone wants to get a hold of us, but you can reach us at theultimatemensclinic.com. This has been your latest episode of the Ultimate Men's Movement. Thank you all for joining.